You want to go directly or? Okay.
Good morning, everybody. First of all, I would like to wish all the doctors here a happy Doctors' Day. I welcome you to the inauguration ceremony of the Professional Certificate in Hospital Management. Here at IIM Bangalore, it is our motto to expel the darkness of ignorance with the light of knowledge. And on that note, I call upon Honorable Health Minister Dr. K. Sudhakar, respected IIMB Chair Dr. Devi Shetty, IIMB Director Professor Rishikesha Krishnan, and Chairperson MOOCs and Digital Learning and the Program Director for this program, Professor Vasanthi Srinivasan, to start this event by lighting the lamp. We also request one of the learners, Dr. Renuka, to join us for the lamp lighting.
Yeah.
I now invite our director, Professor Rishikesha, to address the audience. Thank you.
Yeah, very good morning to all of you. Let me offer a special welcome to our guest this morning, Honorable Dr. K. Sudhakar, Minister for Health and Medical Education, Government of Karnataka. I will shortly introduce Dr. Sudhakar, but before that, let me just say a few words about the institute and this program. So IIM Bangalore is completing 50 years next year. And we, of course, started primarily with a focus on management education. But over the years, we have diversified a little bit beyond that to get into some specialized fields, including healthcare and hospital management, which we are going to be launching the program today. IIMB has a long history of contributing to public policy and public systems. In fact, when the institute was first started, that was our focus area. Over the years, we have gone deeply into business management as well. And of course, our flagship two-year MBA program is focused on business management. But we continue to have a strong involvement in public policy, public systems, and all the sectors that go along with that. And this new initiative, which we are launching today, which is a certificate program on hospital management, is part of that overall endeavor. We decided about 8 or 9 years ago, in fact, in 2014 specifically, that we needed to diversify the way we teach so that we can reach many more learners. As part of that initiative, we launched the whole MOOCs and digital education platform. We have been quite successful in that. In the last 8 years, we have more than 50 different courses running on edX, which is a platform originally started by Harvard and MIT. We also now offer courses on our own platform, which is IIMBx, as well as on SWAYAM, which is the Government of India's platform for online education. Thanks to all these programs, we have been able to expand our reach considerably. Today, we are able to reach out to more than 1 million learners across the world in, I understand, more than 150 countries. And all of this has been possible because of the excellent platform we have laid in digital education. So this program, which we are launching today, is building on our expertise in this area over the last many years. And of course, has also benefited significantly from the expertise we have got on hospital management, thanks to the involvement of our chairman, Dr. Devi Shetty. In fact, today, if this program is getting launched at all, it is largely thanks to his urging and his persuasion and his constant follow-up with the team here at IIMB. As you all know, Dr. Shetty has been a great proponent of making all types of things accessible. Of course, his first focus was on healthcare. But ever since he has been our chairman, he has also been goading us to look at accessibility for education. And where healthcare and education can come together is, of course, a course like this. So needless to say, it is thanks to his encouragement, motivation, and constant pushing that we are launching this program today. But it's not only push, he has made available to us a lot of resources as far as hospital management is concerned. He gave us access to his hospitals. We've been able to take learnings from the doctors and the other medical professionals in the hospital setup. So all of this has enabled us to launch a really, what we hope is a world-class state-of-the-art program on hospital management. So Dr. Shetty, many thanks to you for all your support. I'm delighted that we have with us today our very dynamic health and medical education minister, Dr. Sudhakar. In fact, Dr. Sudhakar is a very proactive gentleman. I mean, among all the ministers or all the departments in Karnataka, he is the one who has regularly chased me. He, in fact, I didn't actually contact his office, but his office invited me to have breakfast with the minister about a year ago. And I went and I spent almost an hour talking on how IIMB can contribute to various initiatives which the minister has taken. We all know that he is one of the youngest cabinet ministers in the Karnataka cabinet. And of course, during COVID, we have all seen firsthand what are the kind of initiatives he has taken in order to make sure that the state has been very proactive in responding to all the challenges. So it's indeed a privilege that we have him with us today. He is also very active in many other areas. He has a very strong passion for ecology and the environment. He has taken many initiatives, both in his own Chikkabalapura constituency as well as at the state level. He has been very passionate about reforming and completely restructuring the health department in Karnataka. And that's why I went and met him to discuss some possible initiatives in that area. And we have been particularly lucky that he has been able to hold both the portfolios of health and medical education together so that he could give an integrated look and perspective at this sector. So thank you, Doctor, for being with us today. And thanks for all your support and blessing for this program. So once again, let me welcome all the participants. We are delighted that we have a large number of registrations. We hope we will have many more before the closing date. And this program, of course, we hope it will become one of the flagship online courses of the Institute, where we will have regular participation from people across the sector. The Health Minister has been kind enough to consider nominating doctors from the government health setup as well for this program. That will add further strength to the program. So thank you, Doctor. And with that, we are quite confident that we'll be able to make a significant impact on improving healthcare and hospitals in the state and even beyond the state. So thank you once again, welcome, and I look forward to hearing from both the minister and our chairman. Thank you.
I call upon Dr. Shetty to come and address the crowd.
Good morning, ladies and gentlemen. Today is a true dream come true for me. 4 years ago, when I was made as the chairman of the IIM Bangalore, the first thing I wanted was a course for healthcare professionals in administration. Thanks to Rishi, thanks to the wonderful faculty members of IIM Bangalore who are so passionate about teaching, this has become a reality. Thank you so much. I'm extremely grateful to our Honorable Health Minister, Dr. Sudhakar, for launching the course, because I couldn't have thought of any other person better than him in launching the course. We have seen him, our entire fight against COVID was led by him predominantly. Today, we can say that Karnataka has definitely done perhaps one of the best given the best performance in managing COVID, thanks to his leadership. We are very proud of you, sir. Why administrative course is important for doctors, nurses, administrators, and every paramedics and everyone involved in healthcare. This is important because most of the even senior doctors who are managing big hospitals really do not have a clue about how the administration or how the financing and how the HR function works. Today, healthcare in this country of most of the people are not delivered by corporate chains like ours. It is offered by 30-bed, 50-bed nursing homes across the country, mainly in tier 2, tier 3 cities. They are the people who take care of more than 80% of the illnesses which our people suffer from. And everyone thinks that they are raking in money. And these doctors themselves think they are very successful in whatever they are doing. But reality is most of the business is sick. All they have is enough money to pay the salaries and have some money left in the bank. They don't think tomorrow there is a medical legal litigation and a court fines them 1 crore rupees malpractice compensation. Do they have that much of money to pay? Have they got the insurance? They have no idea. Why these hospitals are successful? They are financially successful because great-grandfather gave the land and the father built the building. Whenever they had some loose money, they bought some equipment which keeps running. They have no idea when the ultrasound breaks down after 5 years, whether they have enough money to buy it. And when they buy it, the money what they charge the patient, is it enough to calculate for the return on investment? They have no idea. And this is the way most doctors run their hospital. I know personally a very dear friend of mine running a very successful 100-bed hospital. For whatever reason, he was in financial difficulty and he was asking for advice. He explained to me in detail, look, I had all these problems. Then I wanted to expand part of the nursing home. I needed 2-3 crore rupees of money. And my dear friend came forward. He bailed me out. He gave me loan with low interest rate. I said, that's great. He's a very nice person. But what is the interest rate? And this doctor, senior doctor, tells me it is just 2%. Then I asked him, that's great. But is it 2% for a month or 2% for a year? Then that he didn't know. Then he called his person who takes care of the finance. This loan I bought 2%, is it for a month or 2% for the year? And that person told him that it is 2% for a month. That is 24% per year. If he went to the bank, he could have got for 7% or 8%. Then I told him, dear friend, your friend is not a friend. He is charging you 24%. And this aspect is not known to even the senior doctors. This is the level of knowledge they have in managing hospital. My request to all of you is to spread the message. Everyone, doesn't matter, this is the online course. Wherever they are in the country, they all can enroll. In the process, our country of 1.3 billion people will have one of the best healthcare delivery model, and we can become the first country in the world to dissociate healthcare from affluence. And this is our aim. And I'm extremely grateful to IIM Bangalore for making it happen. And I'm extremely grateful to our Honorable Health Minister for launching the course. Thank you.
I now call upon our chief guest, Honorable Health Minister, Dr. K. Sudhakar, to please come and address the crowd.
Good morning to all of you. First of all, I would like to wish a happy Doctor's Day. So, Dr. Devi Prasad Shetty ji, Chairperson of IIMB, Professor Rishikesh Krishnan ji, the Director, Professor Vasanthi Srinivasan, Chairperson, Digital Learning, and all the faculty members of IIMB and those who have enrolled for this historical and very useful curriculum. It is for not just health professionals. The management course is essential for every individual, irrespective of the profession in which he is. So, the healthcare industry also requires good management, good managers, and good management system. The good management will ensure the healthcare delivery system is achieved to the satisfaction of the patients. And we should ensure, our goal is to ensure any hospital, right from dispensary to the super specialty tertiary treating hospital, tertiary care hospital, should cater the highest level of service to the patients. So if that has to be achieved, a proper administration, proper management is essential. On the other hand, if there is a poor management of the hospital, then it can lead sometimes even to the death. It is a matter of life and death of a patient. So there is no scope for much errors in our healthcare profession. So this, in fact, this course that you are starting from IIMB with a partnership of Dr. Devi Prasad Shetty, it is really like my dream getting realized. Since the time I became a health minister, I was constantly, every Monday, I have a review meeting of my department with senior officials. There is always one permanent agenda is to train our doctors in administration, in managing the facilities. Because I've understood, coming from that background, and since I worked in PHC, since I worked in some government facilities earlier in my career, I understand the lacunae that we face in running our government institutions. At least I do not have the exposure of what exactly, how exactly the private establishments work. as a matter of fact, I know that corporate hospitals are run much more professionally than our government sector. For a simple reason that they have better managers who are professionally equipped with knowledge and hands-on experience. In terms of investment, I can really tell you, government spends much more on infrastructure, much more on maintenance, but the end result is that the private sector performs better. So this hard fact I have learned. So that is the reason why I wanted all my doctors, because I do not blame our health professionals. It is not their sin. It is not their mistake. Straight away, doctors from studying for almost 10 years, they go on becoming a director or a medical superintendent or a dean of a medical college without any administrative experience, without proper training course. We do not have in our medical academics where there is a subject on administration, like how we have a subject for handling, mitigating any public health events. We do not have. Community medicine we have. So I really feel that we should, in fact, include the kind of administration, hospital administration, management, skills, even in our curriculum. But this has been an historical moment for me. And this is not going to help our Karnataka alone. This will help the nation itself. So this, it's not just you have started a course, you have helped the healthcare to be transformed. The transformation of healthcare will happen through IIMB and Dr. Devi Prasad Shetty. I really congratulate and acknowledge you for this yeoman's service. So regarding the patient care, as I have already told you, it is the moral and legal obligation of every private hospital entity or a government hospital to ensure that we give the highest level of service care to the satisfaction of people, the patients. And this course, I was just going through, it is offering almost 10 courses, right from finance, strategy, operations, HR management, statistics, economics, and public health. Really, this is like an amalgamation of healthcare studies strategically interwoven with business studies or the management studies, which is the need of an hour. And more so, this is an online. They're presenting with online courses, which is the most convenient for all our professionals. And let me tell you, this is not just for doctors. As I was interacting with Madam and the director, they were telling that it is not just for doctors, it can be even for the nursing heads, it can be for entrepreneurs who is interested to enter the healthcare. These days, we are seeing a lot of non-medicos entering our healthcare space. So this industry is growing multifold. And we are entering a challenging era in the state and in the nation. So this is the right time that Indian Institute of Management Bangalore, which is a top one of the institutes in our country. We are very proud as a Bangalorean, as a Kannadiga. I really feel proud that this institution has given platform and sent millions and millions of students across various sectors. They're doing a very great service, not only to the nation, to the entire humanity. So this will add a feather in your cap. This course specifically will add a feather in your cap. So in the online platform, through your podcasts, videos already recorded, lectures from the various specialists, very reputed doctors like Dr. Devi Prasad Shetty and many more. So the students or those who enroll in this curriculum, in this course, they get the opportunity to interact with such great doctors, great professors. And also it will be like a hands-on experience by interacting. And every week, I think they have one day of offline course as well. Those who can really make it, it would be an added advantage for you. And similarly, I was told there are workshops that will be conducted periodically. So I would like to conclude by saying the hospital management should foster a commitment amongst not just physicians, nurses, lab technicians, data entry operators, and D group workers. Because I had to quote what Dr. B.C. Roy said, because today is his birth centenary. That's why we are celebrating Doctor's Day. He once said, if we exert ourselves with determination, then no obstacle, however formidable, can really stop our progress. So that is the level of commitment that we require, especially in the healthcare. And in one example, I would like to give you what is the advantage of training, especially in Uttar Pradesh recently. We know that WHO has a childbirth checklist, safe childbirth checklist. That training happened they conducted to many nursing community there. So there were about 1,000 units. Out of 1,000 units, 700 units got the training. 300 were not trained. So after the training, when they did a survey, 73% out of the trained lot, they could really implement this safe childbirth module. Whereas it was only 43% amongst the untrained nursing community. So this clearly is an evidence. Training, management courses will definitely help in transformation of healthcare delivery system in India. So the cutting edge and industry relevant curriculum will churn out an army of highly competent health professionals, which will be new India. Like American president said, American roads are good because of, it is not because of America is rich. America is rich because American roads are good. So similarly, I would like to phrase it. India is getting healthy not because India is becoming wealthy. India will be wealthy if India is healthy. So that should be the real intent. That should be the spirit in which our country, the government should progress. I really thank for the opportunity. Personally, I again reiterate my heartfelt gratitude to have started this very noble, very important course in IIMB. Thank you once again. Jai Hind.
Thank you, sir, for those inspiring words. I now call upon our program director, Professor Vasanthi Srinivasan, to give us the closing address.
Thank you, Shweta. And I am going to do two things. The first is a little bit of an introduction to the people who have made many things happen. The IIMBx, the digital arm of the institute, which delivers the MOOCs courses and the hospital management course. I want to just first ask my team to stand up here. Dr. Sudhakar, we have a 35-member team. We have in-house studio facilities. We have graphic designers, we have video editors, and we have camera crew, and we have a whole host of academic pedagogical research associates who help us make this happen. Can I request the MOOCs team to stand up, please? Thank you. Thank you very much. I now call upon my faculty colleagues here, the 10 modules being delivered by them. I'm just going to start with Jose. Thank you, Jose. Jose was the person who initiated, and 2 years later, Jose, you are with me as a program director, and we now are seeing this historic day. Thank you so much for making it happen. Padmini, yeah. Jose is in the strategy area. Padmini is a finance faculty. And I think a lot of points that you made today, Padmini, I'm sure they're all incorporated in your course. Thank you. Thank you. Alan, I can see here, others, you just have to. Alan, I think both of them called out on the medico-legal. And remember, we've had conversations on that. Thank you so much. Alan will look after the public health module that we are going to deliver. Vinay and Rishi together, they handle the innovation module. So they will be contributing. Harita has sent me a mail saying she will not be able to make it. Is there anybody else that I have missed from the list? Let me just, Ashish, you promised me that you will be here. Where is Ashish? Okay, Ashish is not here. Harita, Shankar Venkatagiri, he's in a class. Vinay is here. Deepthi Ganapati is traveling. Saurabh Mukherjee is traveling, and both of them did mention to me. Thanks to each one of you. I know that it's been a long journey, and COVID did not help us very immensely. But I just wanted to thank each one of you for making this happen. And I think when all of us were sitting there and we were listening to the minister and Devi Shetty, I think one of the things that just lay so heavily was the kind of responsibility we carry as an institution. And particularly what struck me was just a comment, Dr. Shetty, that you said, which was, how can we dissociate healthcare from affluence? And therefore, the whole piece Rishi keeps talking about accessible and affordable, I think just kind of reiterated today. And Dr. Sudhakar, I think the point that you made last was really powerful, saying, should we decouple health with from wealth? And I think you were kind of aligning to what Dr. Devi Shetty was saying. And I particularly was struck by the fact that, is it really the managerial difference that makes for a better public health system? And therefore, how should we look at to being able to build that? Thank you for that, for those valuable insights. I think all of us who are here take it back with the kind of responsibility and thinking that it deserves. Now I want to just place on record a formal thanks. Thanks to Rishi. And I don't get too many opportunities to say this, but take this when you're getting it, Rishi, which is that he's an absolutely inspiring leader for someone who's in digital, because I think he's just given us free hand to be able to kind of accomplish the kind of impact that we are able to. And he's been there to just support and back us up when we need. Thanks, Rishi, for that. I have three other people that I would like to thank in particular, because we keep calling out for these people each time in difficulty. The first and the most important set is CAO and his team. Thank you, sir. I think every single arrangement, I think you are the ones who are supporting us. Thank you very much for making that happen. The second team that we would like to thank is the audio visual, the infrastructure, all the support for today's session, including the live participants who are there, who are watching the streaming. The third set of people that I would I'd like to thank is Kavita, communications team, and thanks to the team for helping us with media relations. There is one person that I want to call out and thank, and that's someone who's just quiet and silent in the background, but I think has pulled so much of effort for us. Mr. Pani, I'd like for you to thank. Yeah, he is the invisible force that just drove us through the 4 years to do what we have done. And thank you so much for just being there for us. Yeah, thank you. Last but not the least, I want to thank several staff members, faculty colleagues, and others who have just written in saying how glad they are that we are launching this program. I mean, nothing is more satisfying than having our peers and colleagues thank us for bringing this program. And I see several heads of functions, other staff members from the Institute. Thank you for being here. And last but not the least, participants, you're special. As you will see after this session, that we are going to have continuing education session with you, which we will begin in a short while. But thanks. And what makes it unique, and I keep thinking this, is the first batch is always special to us. Because in some ways, you know, you might think of yourselves as guinea pigs, but please remember the kind of pressure we are under to deliver this module. So in some ways, it becomes a great learning experience for both of us, and we kind of cherish the first batch even more special than all the subsequent batches that follow. And what I wanted to do was just leave the course page as a kind of a launch. And Shweta, if you can just make sure that it's done. Okay. Thank you very much. Thanks one and all. Thank you.
Thanks a lot. Next, Central University Connect. That was also my project actually coming to Spain. First time we started using 3 way back in
So this is how the course page will look like. And we thought we would give you an overview of the healthcare operations management course. And this will be the platform, and this is the welcome to the course. So, yeah. Yeah, we will send you the link, like I promised you. Yes, we will send
Shall
you.
we play the video?
Yeah, just play the video because she talks about welcoming the participants to the course.
Yeah.
Yes. So this is how the content will be presented to the participants. Yeah.
Dr. Karanga, and I think operations management at IIM Bangalore. Since you are watching this video, I'm assuming that you already have some interest in this course and you want to know what this course has on offer for you. Now, irrespective of whether you are a doctor, an administrator, or any other healthcare professional, I'm sure that you have experience, like most of us, a frustrating situation, such as indefinitely having to wait for a doctor, or not finding a medicine in a pharmacy, or not getting your diagnostic results on time, or worst of all, being diagnosed with a wrong disease and ended up taking the wrong medication. Most often, the reason for these inconveniences, which sometimes can lead to major disasters, is inefficient management of operations. This is the reason why operations management is a key topic in the healthcare domain. Also, how to provide high quality healthcare services at an affordable price is a major challenge, especially in countries like India. Of course, there is no one single solution that can solve all these problems for us. But fortunately, there are some best practices and key operational principles that can help us in bridging this gap between supply and demand in a reliable fashion. For example, let us take Dr. G. Venkataswamy, who was the founder.
Is that okay? Should we continue? I thought we could hear. So yeah. Yeah. Okay. Thank you. Yes. Thanks. You need a picture. Yes.
A word to the participants. We have arranged high tea outside. Please, partake in that. But after tea, please come to classroom N001 for the classroom session that will follow this. Only the participants. If you have any queries, please look out for those with the red, ID cards, and you will answer your queries. All of you here, please have your tea with us. Thank you.